I'm Margaret Charlton, I'm a community midwife. I work in North Shields. I'm going to talk a little bit about home births today and why we promote home birth. Home birth it's a really nice for women because women are in their own home, they feel more relaxed, and the midwife is a guest in there with the best will in the world. When a woman goes into hospital, she becomes a patient, and it's a little bit of a power shift. So we are guests in your home. It's a very safe option. There's a lot of statistics to show that it's as safe as giving birth in hospital, providing you're assessed correctly and you are assessed as low risk. A lot of people think you need special equipment. You don't. A lot of women would like a pool. These can be hired or bought, and it is up to your partner to actually fill the pool and keep the water at the right temperature. We tell them how to do that, and to empty it afterwards. All you need are things like towels, preferably old ones, some sort of protection for your floor, possibly some protection for your furniture. You may want to have a ball, a birthing ball around. You may want to have a TENS machine. Most women, I find, tend to gravitate towards their sitting rooms on their hands and knees to deliver their babies. So very few women actually deliver in bed, although it's advisable to have something waterproof on your bed just in case you get there. We monitor the baby just the same as we would in hospital. We keep an eye on you just the same as we would in hospital. And if we're worried at all about anything, then we would advise that you transfer it into hospital for future care. We can do stitching as long as it's not a lot. We can resuscitate the baby should the baby need it, but again, it's very rare. You will have a midwife come out as soon as we consider you might be in labour to assess the situation to see if you're in labour. It may be if it's your first baby that midwife will stay with you for a while before she calls a second midwife, but you will also have 2 midwives for delivery, and we will be experienced in home births. We're used to doing it. Once you've had the baby, then we will stay with you for a couple of hours, make sure everything is all right before we leave you with telephone numbers and contact details should you need them, and then you will be visited the next day by a midwife. First of all, contact the community midwife, tell her that she wants a home birth, and then we will do what we call a home birth assessment. So what we consider to be low risk and what we consider to be high risk, and where we would advise that you didn't have a home birth. So things like if you've got high blood pressure, if you have a high BMI, if you're having twins, if your baby's breech, if there's any worries about the size of the baby. I like attending the home births because it's a very relaxed atmosphere. Although you're looking after someone in labour, the whole process is much less frantic than being in a hospital. I find that women deliver easier and quicker at home. There's a lot of research that looks at animals in labour, and we do know that animals in labour, if they're moved to a place that's unfamiliar, they will stop labouring. So we do know that hormone levels that are like oxytocin are higher when you're at home and you're relaxed. And I would advise anybody to think about it, providing, and I would stress this, that you are low risk.